What's up, Psychedelic Investors? My name's James, and you're watching The Psychedelic Investor, your number one news source for psychedelic stocks and everything MindMed. Today, we're going to be discussing MindMed's Q1 conference call, which was held yesterday on the 17th. And in this call, lots of fantastic information was presented. They put lots of color on their different projects, from 18MC to LSD to treat anxiety, etc. And we learned quite a bit of new info in this conference call. So in this episode, I'm not necessarily going to recap things step by step. I'm not going to say, like, this person said this, and then this person said that. But rather, there are several themes that were emerging throughout the entirety of the conference call that I think it would be important for us to touch on this kind of debrief of the conference call. So the first theme that we're going to be talking about today is the mission of MindMed. So MindMed is a mission-based company, and that was evident throughout the entire conference call. The second theme we'll move on to is talent acquisition. The third is the progress that they're making in each of their clinical trials, and that is going to make up the bulk of this episode. The fourth theme is the future, where MindMed goes from here. And as I was writing this episode, it just kept getting longer and longer and longer. So I eventually decided to split this episode into two different ones. Today we'll be talking about the mission, the talent acquisition, and the progress that they're making on different clinical trials. And then in an episode maybe tomorrow or the next day, we will go over what the near future of MindMed looks like, at least according to this conference call. So buckle in, guys, it's going to be a great episode. But first, if you enjoyed this episode and you want to see more like it, invest in the channel with your like and subscribe. Over time, you'll see your investment grow as we continue to bring you the information that you need to know before investing in the psychedelic medicines landscape. Enjoy the episode. So the first theme that we're going to be covering today is the mission. And one of the reasons that I personally am even invested in MindMed and have been invested in MindMed for more than a year now is because they are a mission-based company. Yes, I believe that I will make back my initial investment times 10 or 20 or whatever, and heck, I already have in many cases, but there are so many fantastic companies out there that exist today that you can make money on, that why not choose one who, while you're making money, will help make the world a better place for all of us who live in it. The mission aspect of the company was actually front and center throughout this entire conference call, which honestly I love. I really think that that is where we should be putting the focus. For example, to start the call, J.R. Ron, who is of course the CEO of MindMed, said this: "We will not waver from our mission to discover, develop, and deploy innovative therapeutics through federally compliant pathways to address large problems in society, including the opioid crisis and mental illnesses based on psychedelic substances." He then, before getting into the financials or business strategy or whatever, he talked about how the opioid crisis is ravaging our communities and destroying lives. He talks about how in the era of lockdowns, the scope and scale of mental health issues is only increasing and at a worrying pace, and how if we, as a society, do nothing, we could see devastation. There are two cores to this problem that MindMed is aiming to address. First, we don't have the medicines to help treat people with these afflictions, and two, even if we did, mental health care treatment is not accessible to the vast majority of people in our society. Therefore, there are two core aspects to MindMed's mission to better humanity. First, develop better medicines. And second, create new ways to scale up mental health care treatment so that no one suffers from a lack of coverage. In the intro, both the tone and the amount of time spent discussing the mission took a clear precedence over some of the things that people may consider to be the big news of the quarter. For example, that MindMed finally got accepted to the NASDAQ. The tone here when talking about the NASDAQ was almost along the lines of, "See, I told you we would do it. Now, if we could please get back to what matters, the medicine." So again, I love the mission here, and I'm investing not only in the hopes that I'll make an absurd profit, which I'm sure I will, but also to make the world a better place. The next core theme that I want to discuss that came up in this conference call was MindMed exalting the progress that they have been making in talent acquisition over the last quarter. In fact, Robert Barrow, who is now the MindMed's Chief Development Officer, when he was giving his opening statement, he gave 4 core principles that underline the development of MindMed's product pipeline. The very first core principle was that they need to bring top talent to fulfill their vision and bring their vision to fruition. And throughout this presentation, on almost every single topic and every single project, they were talking about how excited they were to welcome new talent to the company in this field. For example, on the board, they now have a lady named Dr. Sarah Vinson, who specializes in adult, child and adolescent, and forensic psychiatry. She's the founder of major psychiatry companies. She was an associate clinical professor of psychiatry and pediatrics at Morehouse School of Medicine, where she was also the program director of the Child and Adolescent Psychiatry Fellowship. Plus, she used to be the president of the Georgia Council on Child and Adolescent Psychiatry, and honestly, the list just keeps going on and on. If we talked about her resume, we could fill up the entire episode with this. On top of her, however, they also added many other top scientists. For example, they added a guy named Dr. Peter Mack, who comes from the drug development company AstraZeneca. They also added lots of machine learning experts through their acquisition primarily of Health Mode. For example, here they got 20 plus AI experts, including Dr. Daniel Carlin, who is now the Chief Medical Officer of MindMed, and Bradford Cross, who is now the Chief Technology Officer. So, just taking a step back here, guys, just keeping it real for a moment, I always find it a little bit hard to judge talent acquisitions because, honestly, every company, they always seem super excited whenever they add somebody. They put out a press release being like, look at how amazing this person is. They worked on X, Y, Z. And they always carry with them fantastic sounding titles and pedigrees. But from the outside looking in, it's often difficult, especially without being super nuanced in the world of tech and medicine, to judge these people based on just what the companies say about them. So MindMed does seem genuinely excited about all this talent that they've brought in, and just looking at their biographies, looking at their resumes, they do seem like they're legit, that they're exciting additions to the company. But I just wanted to put a little note here that I find it hard to judge who is good or not. Whenever you look at any company in this field, like once a month they'll talk about how they added this new outstanding person to their board. So just keep that in mind, just keep that little grain of salt in there with the good news of all their talent acquisitions. Having said that, that was a main theme throughout this conference call. On every project they were talking about, they talked about how they added new talent that really deepens their pool of expertise. The next theme I want to go over that was discussed a lot in this conference call is, of course, the most important thing, the progress on their clinical trials. That's why we're all here. We talk about it all the time. When investing in the psychedelic medicines landscape, the most important thing is how progressed they are in their clinical trials. So we were all hoping to get some updates in this conference call on their clinical trials. So we actually did get a lot of good info here, and I'm excited to scheme on it with you. So the very first thing that I wanted to highlight was the way that they are organizing their clinical trials when they were speaking to investors here was new to me. They actually divided all their different programs up into 4 different quote-unquote development franchises. The first was Psychiatry, and within the Psychiatry development franchise, they have Project Lucy, which is of course treating anxiety with LSD, and then they also have their LSD microdosing program to treat adult ADHD. And by the way, we'll get back to this in a minute, but it appears that they have named this program Project Flow, which is the first time that I'm hearing the name, so it's just cool to know that we have a name for this ADHD LSD project. However, I will just say I'm a tad disappointed that we don't have another cool classic rock song name like Lucy or Angie or whatever. It seemed to be a really good thing that they had going there, but whatever, that doesn't really matter. So yeah, that is their first quote-unquote development franchise, is Psychiatry. The second one is Addiction. So obviously in addiction we have Project Layla, which for now is treating opioid addiction with 18-MC, though as we'll get to in a moment, that is set to grow. The next franchise is Pain, and of course, under Pain, we have Project Angie, and treating pain with LSD and maybe other psychedelics in the future. And next, and this is the first really big news to come out of the conference call, at least in my view, in my point of view, the fourth development franchise that MindMed has is for neurology. And for this, we actually don't have any disclosed projects that MindMed is working on. But the company did let us know that they are exploring LSD in a soon-to-be disclosed project. So you heard it on this call first. MindMed is working on a new project that has to do with neurology, and we should be getting indications on what this will be treating and using what substances very soon. Again, I find it interesting the way that MindMed broke down their programs here in this call, placing them under 4 separate franchises. I don't necessarily know if this was just for ease of explanation or if this is going to be how they're structuring their business going forward, but either way, it honestly helps organize their various projects for explanation. Putting them into these categories really makes it easy to explain to people what MindMed is all about. Now, before getting into the updates for each of these programs, it's important to note here that these aren't necessarily 4 silos that are going to be operating completely independently of each other. As mental health issues are intrinsically often related to addiction, and chronic pain is often a precursor to both, we often see people who unfortunately have some chronic pain and who get addicted to the substance that was supposed to treat said pain. And after that, they suffer from debilitating mental health issues as a consequence. So therefore, I would just say we should expect some synergies between these different 4 franchises going forward. Getting into the updates that we have for each project, we got a lot of them. So first up, we have Project Lucy, which is of course the most developed program that MindMed currently has. So on the day of the conference call, we actually got a little bit of news that they received something called the Type C meeting response from the FDA. Receiving this is a step that must be completed before MindMed can file their investigational new drug application with the FDA to start their phase 2B trial treating generalized anxiety disorder for LSD. So there's going to be lots of other steps that they have to pass through, but the fact that they checked this one off the box is, good news. They're marching along towards their mission. So they plan to file this, the IND, the investigational new drug application, hopefully in the 3rd quarter, and they will hopefully start to begin their phase 2B trial shortly thereafter. This trial is going to be placebo-controlled and enroll 200 patients, so I believe that is new info that was put forward in this conference call. There will be 200 patients in this trial, and they will mostly be in the United States. A main goal of this study is to optimize the dose levels to choose one dose for the phase 3 trial, which will be administered only one time. So I think that's more news also that came out of this. So these patients that are in these trials are only getting one dose of LSD-assisted therapy. Of course, they'll probably have therapy beforehand, therapy after, get that integration, all that good stuff. But it is just a little interesting tidbit of news that they're getting one dose of LSD-assisted psychotherapy to complete this eventual phase 3 trial. Another goal of this program is to be furthering our scientific understanding of how LSD actually affects the brain. In other words, what are the underlying mechanisms of action of LSD? Finding a treatment is important because an estimated 6% of Americans will suffer from generalized anxiety disorder in their lives, and very little innovation has been done on the treatment of GAD, generalized anxiety disorder, over the last decades. What makes LSD for treating anxiety so exciting, at least according to MindMed in this conference call, is that most other drugs that are aimed at treating anxiety, they just focus on suppressing the experiences or the symptoms of anxiety. They don't get at the root cause of what is happening inside your body. Project Lucy, on the other hand, at least according to MindMed, hopes to address the underlying issues and causes of anxiety, which will create lasting benefits. And they say this will create a paradigm shift for the treatment of anxiety disorders. So some general thoughts that I have on Project Lucy here. We got lots of great new information in this conference call, including the sample size of their phase 2B trial, the fact that the trial is going to be focused on dose optimization, which I found a little bit interesting, and also that this will have just one dose as opposed to multiple doses like once a month or whatever. I do wish, I will say, that we got some results from the phase 2A trial on this call, or told when we would get some results from this, so we could get a truly better understanding of where we stand on this project, but it looks like we're just going to have to wait. I don't know if this means that we're just not going to get phase 2A trial result data, and we're just going to have to wait until the entirety of phase 2 is complete, and then we'll get some data after phase 2B is done, or if we will still get phase 2A data, but just maybe later this year. Either way, honestly, I'm a little bit disappointed. I wanted to get that data, but maybe that's more of a me problem than a them problem. I'm just an impatient human being. Next up, we have Project Layla, which is again treating opioid addiction with 18MC. Here, we didn't get too much new information. They did say that they expect their phase 2 trials to start either in late 2021 or early 2022. So I would say that this does appear to be another slight delay in the program. However, I'm not too worried about these couple-month delays when it comes to Project Layla. The company has so many different projects that are all happening simultaneously. Plus, we're still in the middle of a global medical crisis, so a delay of a few months here or there is frankly to be understood or expected rather. Plus, as I understand it, the delay in this specific program has more to do with the expansion of the scope and scale of their phase 1 trials so they can gather more data on different dosing levels. So if that is the case, then this is a reasonable reason to delay. We want as much data as possible before moving on, just so that we are sure in our understanding of the science before we move on. Having said that, I do wish that MindMed would start, kind of sandbagging these target start dates a little bit, these timelines a little bit, so it doesn't appear that we have all these delays. So, for example, rather than saying that this 18MC trial, 2A trial, was originally supposed to start at the end of 2020, then the beginning of 2021, then the end of 2021, and now maybe the beginning of 2022, they should have just said from the get-go that they expect to start this before 2023. That way, if their internal timelines run smoothly, then it appears they're way ahead of schedule and everything's fantastic. On the other hand, if inevitable delays do happen, as they often do in the medicine testing world, and as we have seen happen so far, then they don't have to keep pushing back these timelines time and time again, which honestly just doesn't look great in my opinion at least, but again, that's only my opinion. Nothing more. In terms of the treatment itself, they did give some information on some animal trials, comparing 18MC to its parent drug, ibogaine. So just briefly, for those who might not be aware, 18MC comes from ibogaine, which is an extremely hallucinogenic drug whose effects can last several days. However, it has been shown to have great effects in treating addiction in some studies. And 18MC, MindMed says that they have created a drug that has the same healing benefits of ibogaine, but doesn't have the intense multi-day hallucination. So what they have done here in these animal trials is they say that they have shown that 18MC has a similar efficacy rate to ibogaine in treating addiction and, importantly, the withdrawal symptoms. So on top of this, they say it also doesn't have many of the negative effects that have been seen in some studies when it comes to ibogaine, specifically complications in cardiovascular health of certain individuals. So if these claims do end up being true, or rather if what they found in their animal trials ends up being true in humans or holding in humans as well, it does look like MindMed appears to have a real winner on their hands when it comes to 18MC. However, we should note that this is still super early process. We still need to get through all of phase 2 and then phase 3 trials before we can say with any level of certainty that 18MC will be able to treat opioid addiction. Also important to note is it's not going to end at just opioid addiction. The company plans on expanding to other forms of addiction also. So primarily this is alcohol addiction, which they talked about quite a bit in this conference call. And apparently, I didn't know this, but according to them in the conference call, alcohol addiction kills an astounding 85,000 people a year in the United States. And in fact, in the presentation, they say that 10% of deaths that occur in working age populations are attributable to alcohol addiction, which is honestly an insane stat. So hopefully they can get 18MC to be working on opioid addiction, alcohol addiction, because it really does appear that we have a huge societal issue here that needs to be solved. And then, on the business side, there's also a pretty good monetary reason to hope to solve this too. Next up, the next clinical trial or project that we have to look at is Project Angie, which is again treating pain with LSD. So this is their newest project that they have announced, and it's honestly quickly becoming one of my favorite pieces of the MindMed puzzle, the program that I think I might be the most excited for, at least in the short term. We actually did a full episode and breakdown of Project Angie not too long ago, so I'll put a link above to that right now, and then I'll also put that at an end card at the end of this episode, so you can really learn more about Angie and learn why I am so excited for it, frankly. So yeah, we didn't get any new information on this call about Project Angie, but they did kind of recap why it's so exciting and also what they're doing. So MindMed is looking at 2 primary pain indications, and they're going to file to have a phase 2A study on this before the end of the year, or they're going to file before the end of the year. Probably it'll start the trial in 2022. And the chronic pain market is frankly just absolutely massive, projected to grow to around $31 billion a year by 2030. And as big as the economic potential is, the human cost is even larger. It's terrifying, honestly. So many people with chronic pain actually get prescribed opioids, and then, like I said earlier, they get addicted to those opioids, and that's how we got into this opioid crisis. It isn't people originally going to their local drug dealer and be like, give me the most addictive thing you have. No. Their doctors gave them the opioids because they have chronic pain and now they're addicted to their opioids. Then, on top of this, living with debilitating pain, it kinda sucks, and that might just be the understatement of the year, and this leads to a variety of different mental health conditions like anxiety or depression. And anybody that lives with a chronic pain issue knows how true this is. It's not fun to live in chronic pain. Again, understatement. So, the overlap of people that have addiction and mental health issues and those who have severe pain indications is very great. Like the overlap, if you look at this Venn diagram, the overlap is massive. Therefore, to fulfill MindMed's mission of easing the societal burden of addiction and mental health issues, to do this, chronic pain must be addressed. So in the conference call, they actually talked about this quite a bit, how expanding the pain medication is not a departure from their mental health care mission, but in fact, it's a central piece to it. The best way to treat addiction and mental health disorders is to ensure that they never get started in the first place. Pain medication has not improved in decades, and frankly, it's time for a new approach. And this, like I said, has become one of my favorite parts of the entire MindMed puzzle. As we covered in our Angie episode, there's actually quite a bit of evidence that exists already that LSD and other psychedelics can treat pain without addiction. And there is a vast pain treatment market just waiting to be disrupted. No other psychedelic medicines company, at least to my knowledge, there are like 40 of them now, so maybe there's a small one planning on working on this, but no other psychedelic medicine company that I've researched so far is looking at this. So, should MindMed succeed in creating a more effective pain medication that does not cause addiction, well, at the very least, the company is going to have a first mover's advantage in this $31 billion industry. And who knows, maybe they could even have a monopoly. And at least according to MindMed in this call, the societal cost of pain is actually greater than even cancer or heart disease. So again, we have 2 different forces here. We can really help a lot of people, and then also investors can make a little bit of money off of it. So win-win, I guess. So I can't wait till we get more details on this first clinical trial that will be happening again probably next year, maybe the end of this year, but probably next year. Specifically, what I am waiting to know is the dose size of LSD. Are we talking about little microdoses that are taken frequently to ease pain? Or are we talking like one heroic dose for the month to ease your pain for the entire month? Either way, I'm really excited to see which avenue they're going to be looking at. If you watch my Angie episode, you'll know that there's scientific literature done on both of those, small doses and large doses, and they both seem to work, at least in those scientific studies. So finally, we got some info on Project Flow, which again is the name of their program that's using LSD microdoses. And again, I don't like that name. You should have chosen a song title. Anyhow, here we learned the expected start date of the LSD microdoses to treat ADHD phase 2A trial should start in late 2021 and perhaps as early as Q3. And guys, Q3 is like a few months away, so this trial might actually be starting fairly soon. And in this trial, there's actually going to be 56 patients. I believe that's new info. Maybe it's not, but I think that's new info that they gave us here. So in general, I'm super excited to get this trial started. There's been lots of conflicting research done on microdosing, so I'm really excited to see MindMed take a stab at it, and hopefully everything comes back positively. So now we got through my 3 kind of themes that they went through on this call. Yeah, I'll just give some of my general thoughts on it. So yeah, they are mission-centric, MindMed, and that really kind of shined through in this conference call that they gave. They're also focused on talent acquisition, which again was another major theme. And finally, their focus is, of course, on their clinical trials. So when you hear everything that the company is doing, when they kind of just lay it out for you like boom, 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 we're doing this, we're doing that, we're doing this, it's hard not to get excited, to be completely honest. Like, yes, we're still early. We are still going to have to wait like several years before we can say with any level of certainty that these drugs work. But honestly, guys, where we're standing right now, this early in the process, I'm pretty happy. Like, things seem to be going pretty good. As for like where we are going, that's going to be the topic of the next video, which again will probably drop in a day, maybe 2 days. We'll see how we go. And in that video, we're going to be discussing what the future holds, and the sky seems to be the limit. In that video, we're going to be talking about MindMed's transformation into a technology company, the new psychedelics that the company is creating and how this will help them with their IP, and also their partnerships that they're creating with major pharmaceutical companies, which are on the horizon. The last thing we're going to talk about, which is a societal trend that we're seeing and not just MindMed, will be their shift towards personalized medicine, which will be one of the biggest trends in human society over the next several decades. So let me know if this conference call has made you more or less excited for MindMed, to be a MindMed investor, and let me know if you've decided to buy or sell any shares based on this decision. I really want to get your guys' opinions on this. Also, guys, just need to note, I am not a financial advisor. Everything I said in this episode is, of course, just my opinion, and if you enjoyed this episode, make sure you like and subscribe. It really does help this channel grow. It ensures that you keep seeing this information that I know you guys like to see. And I just want to take a moment to say thank you guys for your continued support. I really, really appreciate it. It means a lot. If you want to keep this relationship going, if you're too impatient for our next episode in the next day or two, click on one of the links you see on your screen now. They are great episodes. I know you will enjoy them, and we will talk soon. I love you guys. We'll talk soon. Bye-bye.